Greetings, Club Newtown members, and welcome to this week's episode of CN Fit Tips. This week I have a guest with me, Dr. Marc Estes, actually one of my clients. We just got done doing a workout, and we got to talking a little bit about doctors prescribing medications, surgeries, things of that nature before they prescribe exercise. And I know Dr. Estes, as an avid runner, sprint triathlon, he just got done doing marathons, all sorts of endurance races. He is big into exercise as a way to heal. So, Dr. Estes, thank you for joining me.
Sure.
First of all, why do you think it is that doctors would maybe prescribe medicine before they prescribe exercise?
Sure. Well, first and foremost, it's kind of how we're trained, obviously, is in Western medicine, is to treat with medications, and quite frankly, that's what a lot of the patients expect. They go to the physician and they expect to walk out with a prescription or potentially a surgical procedure or some sort of procedure to be scheduled in the future. It takes time, both from the physician standpoint and from the patient standpoint, to be willing to engage in a treatment modality that doesn't involve medication or doesn't involve surgical procedures, but it involves physical fitness, nutritional or dietary modifications, lifestyle modifications. A lot of people come in with maybe it's hypertension or diabetes or obesity or you name the malady, and they want a pill to make it better, unfortunately, because to some degree that's what our society has kind of insisted upon. But in reality, it's not unlike your vehicle or your house or anything else. If you take care of it and you give it proper maintenance and you do what you're supposed to do over time, there's no reason that you can't avoid most of the medical problems that befall a lot of the citizens in this country. The obesity problems, the hypertension, the diabetes, the subsequent heart disease, strokes, all those kind of things. If you really adopt a healthy lifestyle where you eat right, you exercise regularly, you don't smoke, you don't drink too much, all of those kind of things, you can avoid probably 80% of the things that drive healthcare consumption in this country, and subsequently a phenomenal amount of money that gets consumed, both at the individual level and then of course nationally with the healthcare economic crisis that we face. If you don't take care of the car, the body, the house, it falls apart over time.
Of course, of course. I always tell people that I'm kind of in the preventative maintenance field as a personal trainer, because we want to make sure as trainers that you have the tools and knowledge to help yourself before you ever get to that stage. And I always tell people, why wait until you have to spend hundreds of thousands of dollars on surgery when you can take care of yourself? And a side benefit of that is to feel better that entire time. So instead of walking around with a limp or pain for 3 years and then finally doing something about it, you can live your life normally and feel better about it, right?
Right, absolutely. You feel so much better physically, you feel much better psychologically, emotionally. Exercise, particularly cardiovascular exercise or strenuous exercise, releases a lot of endorphins within the brain, dopamine, norepinephrine, which mimic a lot of the antidepressants that a large portion of the population is on in this country. And so it actually is a wonderful treatment for depression. And then of course you just feel better in general. You're fitter, you don't get out of breath when you walk upstairs, you carry your groceries, or you load the dog food, or whatever you're doing. And then you also get that sense of accomplishment of, hey, look what I did. I just ran a 5K for the first time, or I just ran a half marathon. The sense of accomplishment. And once you get into those series of small successes, they just feed upon themselves, and it just becomes a way of life and a lifestyle. And it's amazing how much pain and agony you can avoid down the road, not having to develop the problems with heart disease, obesity, diabetes, renal failure, all the things that come with the American lifestyle frequently.
Of course. Real quick before we go, what do you recommend to people if they come into your office and exercise can help them? How do you kind of steer them in the right direction?
Yeah, so I work in the emergency department, and I see a lot of people that come in with back pain. Now it's one thing if you fell off the roof and you have a back injury, that's a whole different story. But if your back's just been bothering you for an extended period of time, I actually will get down on the ground and I actually show them how to do foam rolling. I show them how to do stretching. I always carry a lacrosse or a tennis ball with me in my bag at work. Just because I'm frequently sore, and so I'll show them how to roll certain spots that are uncomfortable. I highly recommend massage. I use stretching techniques, ice, those kind of things. I try to avoid using drugs if I can, because A, why should you go pay for the drugs? It's just a Band-Aid. It's not going to actually fix the problem. And B, why do you want to walk around in a drugged up state mentally and psychologically? So I usually try those things first. Now it's different. If you break your ankle, obviously I'm going to give you some pain medicine for your broken bone. But if it's just general aches and pains, there's so many better ways to fix it than just taking a pill. It's not going to fix the problem.
Exactly. And what I always recommend to people, find experts that can help you in that field as well. So the physicians, physical therapists, now you can actually see a physical therapist without having a medical consent from a doctor. So that's always beneficial. And then of course, obviously, personal training.
Right, absolutely.
Right?
Definitely.
All right, thank you, Dr. Estes, for joining us. That's been this week's CM Fit Tips. My name's Lucas Woody. You stay fit, members.